We've got some breaking news in the compound Tirzepatide saga, and I wanted to keep pace with all the news that's been coming out around the lawsuit between the OFA and the FDA as it relates to the availability of compound Tirzepatide, because I know that so many of you rely on the compounded versions on these drugs to maintain accessibility right now. And because of that uncertainty, I think it's important to be armed with the latest information so that you know exactly where things stand. Yesterday, there was some breaking news from Scott Bruner, who is the CEO of the Alliance of Pharmacy Compounding. Now, Scott Bruner is actually the guest on next week's On the Pen Live, and he will be sharing information from the Pharmacy Compounding Alliance's point of view on what's going on here. They're not the trade organization that is actually suing the FDA. That is the Outsourcing Facilities Association that represents 503Bs. The Alliance of Pharmacy Compounding actually encapsulates a broader range of compound pharmacies than the OFA does. But let's get into the news because this is very impactful. Essentially what happened was once the OFA and FDA went to court here and the FDA responded by basically saying, let's put this on pause. We're going to reevaluate whether or not this actually needs to be on the shortage list. So they went back to the drawing board, and basically both parties have to report November 21st to the court on where things stand. Now, this response from the FDA essentially telegraphed that they didn't intend to enforce anything against compound pharmacies during this time. But since the suit was brought by the OFA, which represents 503B pharmacies, this left 503A pharmacies sort of in the dark as far as guidance. So the Alliance of Pharmacy Compounding essentially petitioned the FDA at the end of last week on what this guidance means for 503A pharmacies. Again, 503Bs mass produce copies of medications that are in shortage without the need for an individual script, whereas 503A pharmacies receive an individual script and fill an individually compounded medication. So the 503As were sort of lost, didn't have a lot of direction. So the Alliance of Pharmacy Compounding stepped in to get clarity from the FDA. They received a correspondence from the FDA yesterday, and I want to tell you what that response means. So the FDA basically came back and said, we intend on treating all compounding pharmacies equal during this time, insofar as they don't intend to enforce anything against pharmacies that compound Tirzepatide during this period between now and November 21st, when the case could presumably resume. Now, we don't know what's going to happen in the case at that point. All that is going to happen on that date is basically a status update to the court on behalf of the FDA and the OFA. Presumably by that time, the FDA could make a determination as to whether or not to add Tirzepatide back to the shortage list, in which case compounding would continue status quo. They could also say, you know what, we reviewed it. Eli Lilly does indeed have the capacity and the backstop of medication to deal with the influx and the continuation of the rise of prescriptions being written for this medication. So therefore, it is off the shortage list. They could go either way. And we have theorized and hypothesized about what might happen if that goes either way. If you missed last night's On the Pen Live with Lee is On the Pen's legal correspondent. He's been following this very closely, and we wrapped back and forth for about 45 minutes over where this all sits. So if you missed that, go back and check that out. It'll give you the full breadth of where everything sits right now. But this is really good news because many people who rely on compounded medications were receiving their medication from 503A pharmacies. This gives clarity as to what they can do over the course of the next few weeks. Again, I think I can't reiterate enough that this is not tantamount to compounds continuing unabated during this time because, as you know, Lilly still has the prerogative to enforce their patent, as all of the cease and desist letters that were sent out cited the fact that tirzepatide was removed from the master shortage list. What's going on in this lawsuit has not put tirzepatide back on the shortage list. So from Eli Lilly's perspective, it's par for the course, nothing's changed, and I think they have an expectation that people will be following their cease and desist letters. As many people have pointed out, cease and desist letters are really meaningless. What happens in response to them is really where things could get interesting. If Eli Lilly does indeed enforce their cease and desist letters, if people didn't respond to them, or if people are continuing to act in the same manner, they could file lawsuits to protect their patent against the recipients of those letters. So we'll have to see. Next week is going to be very interesting to watch. Like I said, Scott Bruner, the CEO of the APC, will be on the pen to give their point of view. We're hopeful that we can sort of get a perspective of the manufacturer the following week. And it'll be very, very interesting to see what comes of this. And of course, we're going to stay on top of it here at On the Pen, because that's what we do. We give you all the news so that you can have more competent and confident conversations with your medical care team so that you can get the treatment that you need for your chronic disease. If this video was valuable, please share it somewhere where other people might find it valuable too. Make sure you hit the thumbs up button. That helps other people see this. And the subscribe and bell notification will make sure that you know when we upload new videos, so that you never miss an update like this. Thanks for watching. Thanks for being the best part of what we do here at On the Pen. Until the next one, we'll see you later.